So prior to going into the bedroom or into the room where the patient is, what I would do is I'd gather my equipment, gather all supplies that I need, such as my vital sign machine, my stethoscope. I'd grab some ice pack, maybe some pads if they're needed, and then I'd go in and talk to my patient. All right, so, hey Mom, my name's Danny. I'm gonna be your nurse today. I'm here to do a postpartum assessment on you. How are you feeling today?
I'm feeling great, thank you.
Awesome, okay. I'm gonna go ahead and provide some privacy for you really quickly, and I'm going to assess your vital signs. All right. All right, so I'm just gonna tap the blood pressure machine on you, pulse ox here. We'll go ahead and take your temperature, okay? And we'll check your heart rate. And while I'm checking your heart rate, I'll be simultaneously checking your respirations without you knowing, okay? From here, we're gonna start you off in the semi-follows position, okay? I'm going to ask you some questions about breastfeeding. How have you been doing breastfeeding the baby so far?
No problems.
No problems, okay. At this point, I would go ahead and assess the breast of the patient. I would look for engorgement, some redness, or tenderness. I'd also assess the nipples to make sure that there aren't any cracking, any redness or bleeding, okay? How's everything going there for you?
No problem.
Is the baby latching on correctly?
Yep, good eye contact.
Good. And remember, if you need any assistance, just let us know. We have a latching specialist that can help you out, okay?
Heart rate.
Okay, so then after I go ahead and assess the breast, I would ask if the patient has urinated today. Have you urinated?
Yes.
Okay, awesome. Are you having any burning with urination?
No.
Okay, and how frequent are you urinating?
Every couple hours.
Okay, that's good. Are you drinking any fluids?
Yes.
Awesome. Okay. After I made sure that have you voided today? Have you voided before the examination? Because if not, I'm gonna have to have you void.
Yes, I did.
Okay, awesome. All right, so I'm gonna lay you down in the supine position now. Okay. Are you comfortable?
Yep.
Okay, awesome. I'm going to go ahead and assess your bowel sounds really quickly. Obviously, this would be with the gown up. Okay, awesome. Have you had a bowel movement today?
Yes.
Okay, awesome. Then how did your bowel movement look? Was it normal?
Normal.
Okay, awesome. Have you been eating anything?
No.
No? Okay, well hopefully we'll get you something to eat now that you've had your bowel movement. Now remind me, did you have a C-section or did you give birth naturally?
Naturally.
Okay, awesome. Okay, so after I assess the bowel movements, what I want to do is I want to assess the fundus now. The fundus is going to be somewhere between the umbilicus and the pubis bone. Okay, so I want to make sure that the placement is right for that. Alright, and the fundus is where it's supposed to be. Okay. From here, let's see. I would turn my patient to a lateral position. So what I'm gonna do is want to roll you over. I'm gonna assess your site to see if you did you have an episiotomy?
Yeah.
Did they end up having to cut you in your
Yes.
perineal area? Okay, awesome. Well, we'll go ahead and roll you over, okay? And from here, I would be assessing for lochia or any bleeding. I see that there isn't any bleeding. I would know for approximation. I would be looking at the patient's pad now as well to see if it's saturated. I don't see anything there, okay? And then I would go ahead and lift my patient's buttocks up and assess for hemorrhoids. I would note how many there are, the color, and good stuff like that, okay? So I'm seeing that you have no hemorrhoids, and I'm seeing that your incision site looks really good. Okay. Are you having any discomfort there?
No.
Okay, awesome. So now what I'll do is I'll assess for home inside. So I'm gonna go ahead and lift your leg up. Hey, are you having any pain? Bend your knee for me. Are you having any pain on your lower legs?
Nope.
Okay, what we want to assess for is for DVT. We want to make sure that we have SEDs present for the patient, sequential compressive device, or any stockings for the patient as well. Okay, we see none of that there. So your pad looks pretty clean to me. If you do end up seeing any bleeding on your pad, just let us know because we'd like to take a look at it. Also, you might notice, if you notice any odor or anything unusual down there, also let us know. Okay, I'm going to raise the bed over your head. Okay. Alright, and then here I would ask questions pertaining to injections. So with the rubella shot, have you gotten it? Has your baby gotten it? I would ask for the RH globulin injection that you would get if your baby was RH positive and the mom was RH negative. That way it doesn't affect future pregnancies. And then I wanted to ask you questions. How are you doing with your baby? How's bonding going with the baby?
Everything's wonderful.
Okay, awesome. And then how are you doing personally?
Good.
Good. Okay. And then lastly, I would ask, how's your support system at home? Has anyone reached out to you since you've been here? Good.
Well supported.
All right, awesome. Are you having any pain after we've done this examination?
Nope.
Okay, awesome. Well, if you have any pain, just go ahead and let me know. Do you have any questions for me?
Not at present, nope.
Okay, awesome. So then after here, I would go ahead and discard my gloves that I had on to do my examination, perform hand hygiene, and then tell the patient that I'd be back in an hour to go check on them. I want to make sure the patient's bed is in the lowest position, make sure she's comfortable before I leave, and make sure she has everything she needs so that way she can be comfortable in her hospital stay. Okay?